If you want to age well and prevent disease, it can be really hard to do that if someone else is dependent on you for their well-being. And a great example of that is to be a caregiver for a loved one. And I recently made a video I'll show here all about aspects of being a caregiver that no one really talks about. And the reason it's important today is because there is a growing number of individuals who are requiring at-home care, especially parents, grandparents, spouses, things like that. And the burden of caring for them can negatively impact the health of the person providing the care, the caregiver, right? And the reason I'm so passionate about this is because 30% of caregivers die before those they are caring for. Then that number can really skyrocket or get higher when we look at specific health conditions. You might know the rates of Alzheimer's, it's increasing rapidly, and it is estimated that about 40% of the caregivers who care for someone with Alzheimer's die before the person with Alzheimer's. Now, why would these things be? And to emphasize here that this is not meant to demean or make negative the aspect of being a caregiver. It is more so to bring to light the necessity of some issues and hurdles to taking care of yourself as a caregiver to hopefully address it. We cannot change what we don't know, right? So let's address these things together. I'll provide my own insight as my own experience as a caregiver. Just a short reminder, I am a caregiver for my father. He suffered a life-altering stroke, now requires 24-hour care. And I was also a caregiver for my mom during her short stint. She was diagnosed with cancer and passed away 5 months later. And so dealing with all that, I have experience and I'm still experiencing a lot of these things. So I hope this is helpful. Aspects of being a caregiver that no one talks about, part 2. Number 1, spending hours waiting in the ER. ERs are a wonderful thing. However, you have probably noticed lately that a lot of people treat them as their local physician. And this can be really frustrating. When you go to an ER for emergencies, you are put in line with masses of people, and they're a horrible place to wait. A lot of times they are horribly run, and it's really hard to make sense of things. It creates this kind of frantic mentality, especially when you go in with someone who you know needs immediate care and no one's really reacting the way that you react, right? And so you have people there who are waiting for medication for a fever they have next to someone who is suffering from 10 out of 10 pain and has cancer and received chemo last week, right? It is a very odd mix of people, and spending hours waiting in the ER is hell. It really is hell. You feel helpless. You aren't sure if the person you're with is going to get the help that they need. You can go ask for help, but it's not, they can't really do anything. They are overrun with individuals who really use it as a doctor's visit. And of course, who need emergency help as well. Here are some tips just a few things that I've learned taking both of my parents to the ER. Number 1, if you truly feel like it's an emergency and you do not have the ability to carry them or get them to the ER waiting room, it is faster, or it can be faster, to call 911 when it's appropriate. However, and the reason is that you will bypass the waiting room. You will be put in the triage of an emergency going through the acceptance of the ambulances. Now, I would not use that, obviously, if you're like, oh, well, you think your parent or the person you're caring for has a UTI. That's not appropriate. I do use this, or I have used this many times with my father. He's had seizures. We thought he was having another stroke one time. And so I have noticed that you obviously if you really, really think it's an appropriate situation, you should just call 911 rather than trying to put someone in a car who has limited mobility and then trying to get them in the waiting room. Now with my mom, she had instances where it was appropriate to go to the waiting room. It was not an emergency, but where we needed to call 911. However, we still had to wait so long. So just keep that in mind. Also, when you do go to the ER through an ambulance, it doesn't mean that you get seen right away, right? One of the last ER visits with my mom, she was in an ambulance and I went with her to the ER and we waited in the hallway with her on a stretcher for way too long. It is not an immediate fix, okay? And these situations can be very emotionally exhausting and you just feel helpless. And so if you've been in that situation, you have waited in an ER and you think it's horrible, you're not alone. It is horrible. Another tip for these situations to help you as the caregiver, always bring some water. It can be really hard to get water. You might be there for 8, 12 hours. I would always bring a jacket or a sweatshirt. It can be really cold. And then I would bring a snack if you feel like you're gonna have an appetite. You might be there for a while. Always bring a phone charger. Those are things that when I knew my mom or dad would be going to the ER, that was what I always put in my bag. Make sure that I have those things readily available. But ERs can be very horrible. You're not crazy. Number 2, another aspect of being a caregiver that no one really talks about is needing to be alone, but also needing to be social. So the physical and mental weight of being a caregiver can lead to exhaustion, and that is exhaustion mentally, emotionally, right? But also physically. You can feel it in your body. As you help carry someone else mentally and physically, right? We're always trying to make sure someone else is happy or cared for. It can feel like a burden to be around others, and it can also make being alone really, really appealing. Because if you are a caregiver, you might also be prone to helping others all the time. And it can make being alone feel like a recharge for your system because you don't have to tend to anyone else. However, there's a fine line with that. When my father first suffered a stroke and it was a very tumultuous time. It happened out of nowhere. We didn't know how we were going to care for him. He kept on getting discharged, put back in rehab facilities. We had to sell my parents' home. My mom, it was a lot. I would finish taking care of him and then I would have to go home and disconnect and not think and not be around anyone for hours before I went to bed. It was my favorite time of the day and I needed it to refuel. However, a slippery slope for that is then I started to isolate myself. I started to not be as social because it was so exhausting to be around other people. So there's a fine line with that. You need to get out of your comfort zone a little bit, find people in your life who are life-giving rather than life-taking, because our loneliness is just as detrimental, you might have seen or heard, as smoking cigarettes. We are meant for connection. We need to have people in our lives. And as a caregiver, you need to find, you don't have to have a ton of friends. You don't even have to have many friends, but there should be a select number of people in your life who you can talk to or meet up with and connect with on a regular basis. So it's really important to rest and enjoy alone time as needed, but we also have to avoid self-isolation, and I'm guilty of that, okay? So don't let that be a negative part of your life that ends up derailing your health as well. The third thing about being a caregiver that no one really talks about is managing medications and watching for side effects. So when you care for someone, you are expected to know what they are on. You also have a duty to make sure that you understand potential risk factors and side effects for what they're taking. If you go to the doctor, if you go to the ER, you need to know what they are on, because likely the person you're caring for will not be able to repeat that information. A lot of times, in my experience, doctors and nurses in doctors' offices don't really go over side effects of medications, but you need to educate yourself on this because you need to make sure that symptoms that your loved one is experiencing aren't just a progression of a disease process, but rather they could be a side effect to medication. I'll give you an example. My dad was put on a beta blocker metoprolol. And if you're familiar with those, these can help with blood pressure, but they also lower the heart rate. And no one told us this. I know this from being a nurse and dealing with beta blockers, but beta blockers also, they can help with blood pressure, but they also lower the heart rate. And my dad has a low resting heart rate. And so he was having symptoms of fatigue, lethargy, he was falling asleep in his wheelchair at inappropriate times. And we checked his heart rate and it was very, very low. So this medication was actually causing him to have a low heart rate. What we should have been doing and what we do is check his blood pressure and his heart rate daily. And if it is below a certain number, we don't give him that medication because it can cause low heart rate and make him very bradycardic, have a very low heart rate. This is not safe, okay? So we discontinued that medication. You should know those side effects, but who's telling you? So that is one aspect. You are constantly expected to not just manage medications, make sure they take them daily, but also to know the side effects of certain medications they're on, because no one's telling you. And how are you supposed to advocate for someone and take care of them if you don't know what's going on with their medications? Make sure you know those things, but that is another thing that is very time consuming, right? And challenging. Number 4, speaking of medications and healthcare, scheduling doctor's appointments and managing care and transportation. It is hard enough to schedule doctor's appointments for yourself. Throw into that managing not just doctor's offices, scheduling that doctor's appointments, scheduling that into your own routine, but also setting up an online profile, right? Making sure blood work and urine samples and imaging are done in a timely manner. Making sure that you have the right car and the right way to get someone that you love there, especially if they have a mobility issue. Making sure that the person you care for can last the hour-long wait in the waiting room that often accompanies going to the doctor's office. Making sure that you have access to the right restroom facility or needs for the loved one that you're taking there. No one talks about that, especially the doctor's office when you're trying to call and schedule these things, right? Especially the medical transport thing. My mom, she needed a walker, but there towards the end, she was becoming so weak, it didn't make sense to me it almost didn't make sense to take her to the doctor's office because it was so exhausting. With my father, he used to be able to transfer from a wheelchair into a normal car, but they took away physical therapy from him for a period of time, and he has since lost some mobility. So now we need a wheelchair accessible van. And maybe you can relate to this. So what we did is we relied on a medical transport team or a company to transport us to these doctor's office visits. And they're horrible. They are horrible. They'll pick you up on time, but you will likely wait, or you can wait up to an hour. And that is not a luxury that my father can have. And so the last time it happened, even with me giving them a 30-minute heads up, you call them and they say, oh, we'll be there, we'll be there, we'll be there. An hour later, they're there. After we've already waited an hour in the waiting room, and then you see the doctor for a short 10, 15 minutes, then you wait an hour for transport. Who knows how long it'll take you to get home? We're not doing that. And so what we've ended up having to do is rent our own van. We're trying to get my dad a wheelchair accessible van, but in the meantime, all these things are things that no one really thinks about. You or I, maybe we can just get in the car, go down to the doctor and come home and complain about it because it's really hard. Someone that you're caring for, you have to think about getting them there, how they'll get home, all these other things. And it is a challenge. It's a puzzle piece. And so that's another aspect that no one really talks about, but it can be very stressful. And a final aspect of being a caregiver that no one really talks about is trying to remember and to not forget who they were before you started caring for them. Everyone has a life prior to who they are when they need assistance. And it can be very mentally challenging to watch someone in a state where either they're mentally confused, physically disabled, and to forget who they were prior to that situation. And this is something that can really be mentally challenging and make it hard to process life. Other than to put it lightly, like, it's just an aspect of being a caregiver that is so mentally hard. And that challenge increases, especially when the person you're caring for can treat you horribly. A lot of people with Alzheimer's and dementia end up being aggressive, let alone they may not remember you, but also they can tend to aggression. Not everyone, but a lot of times. And so being able to realize that confusion or anger in the person that you're caring for is not actually the person who you originally knew, if that makes sense. And also being able to step back and not let that anger or frustration from this person that you're caring for be a reflection of the work that you're doing. Something that has really helped me is, this might sound kind of silly, but I hope this helps you, is when I have seen my father or my mom in times of dire need, but also be very unlike themselves. Something that really has helped me is to imagine my father, for example, prior to having a stroke. So let's say when I was when I was younger, let's say 10 years ago, I picture who my dad was then. And if my dad then was standing here watching who he is now treating me, how would my dad from 10 years ago react to that? And what would he say? And when I look at it that way, I am able to continue and also almost brush off what my dad today might be doing or saying, because he doesn't know what he's doing or saying. And this man here, my father, who I remember before the stroke, I know he would tell me, thank you. And I know that he would tell me to disregard what he's saying here because it's not true. And that is really, really hard. You have to really have patience. You have to really take note and keep yourself in check, and to remember that although my father today does treat me really well and he does say really nice things to me, there are times in his life where he is very confused and people say hurtful things, and so, or they don't understand what's going on, and that confusion can lead to very hurtful situations. And so being able to step back is very, very important. And so one helpful thing is to not take it seriously. Imagine the person you knew before they got sick or before their life was altered, before they needed your care, and how would they treat you now? And that has helped me, and I hope that helps you. And that is one of the blessings of being a caregiver for a loved one, is you know who they truly are, and you can treat them with that love and care that they really deserve. Because that's why we care for our loved ones, right? So that ends video 2. There will be a third one coming along. If you have any questions or comments, please let me know below. Follow along for more, and hope you have a great day. Take care.